Hi there, students. Welcome to Crazy Nurse RN channel, where learning becomes a tradition. Today, we'll start the quick PNLE and NCLEX-RN review discussion. For today's topic, we have stages of labor and delivery. This review video was made by Crazy Nurse RN to help student nurses, unlicensed nurses, and professional registered nurses who wanted to prepare for exams and gain insights about nursing topics. If you think this helps you, please subscribe, like, and share this video. Kindly visit Crazy Nurse RN YouTube channel to watch, listen, learn from this review discussion. Let's begin our review session on stages of labor and delivery. There are 4 stages of labor and delivery. For stage 1, it is called your early, active, and transition stage. Occurs when the mother begins to feel regular contractions, which cause the cervix to open or dilates, and soften, shorten, and thin, effacement. Allows the baby to move into the birth canal, and it is the longest part of all stages. In stage 1, our main responsibility as a nurse is to monitor fetal patterns. So we have bad signs or bad fetal patterns. First, low fetal heart rate. This is under 110 beats per minute. The normal fetal heart rate is between 120 to 160 beats per minute. So in the event that there is low fetal heart rate, you will do lion. So what is lion? So L stands for left side. This means that you have to position the patient or the mother on her left side. This is to prevent vena cava compression, thus increasing blood flow to the baby. We also have to secure IV access for medication administration. Then we have to provide oxygen supplementation, and lastly, we have to notify the physician or the doctor. Another bad fetal pattern is your low baseline variability. It is when fetal heart rate stays the same and does not change. Normally though, if the mother's uterus contracts, the baby also reacts to it. So there is a changes in his or her fetal heart rate. So if there is no change, although the mother's uterus has contracted, that would be a problem. So our treatment here is the same. So we perform or we do lion. We also have your late decelerations. Heart rate slows down near the end or after a contraction. So usually, if the mother or if the baby has a late deceleration result, there is a placental insufficiency. That means there is a lack or insufficient blood flow going to the baby. So again, you will be performing or you will do lion as well. We also have your variable deceleration. This is a very bad fetal pattern. Okay, this indicates prolapse cord. Okay, when we say prolapse cord, it is where the umbilical cord of the baby comes out first. So if it comes out first, what should we do as a nurse? So first we have to put a wet gauze to cover that umbilical cord. That is to prevent dryness. Also, we have to position the mother in Trendelenburg position. This position relieves pressure from the cord. Okay, so these are the 2 things or emergency actions that we have to perform if we have a prolapsed cord. So these are the 4 major undesirable fetal patterns that we need to observe from our patient, and we have to take action for this. Aside from the bad signs, we also have good signs. And these are the signs that we need to observe from our patient. And these are all normal signs or normal findings. First, high fetal heart rate. So that's over 160 beats per minute. Okay? So this also means there is an acceleration. And we want this acceleration for the baby because it notes that our baby is reactive and that he is alive inside the mother's womb. So if this happens, it's a no big deal. We have to document. And we need to take mother's temperature. It might be an effect of increased body temperature. We also have here high baseline variability. It is when fetal heart rate is always changing. As what I have mentioned in my earlier slides, if the mother's uterus contracts, the baby also reacts to that. Okay? So there is a change or there is a variability on that sense. So that is a good sign. So all we have to do is to document. And we also have your early decelerations. It is where the baby's heart slows before or at the beginning of a contraction. And this is normal. Okay? This signifies head compression. Okay? So it is expected that in your labor and delivery, the baby's head should be compressed in preparation for expulsion. Okay? So that is good, that is fine, and we have to document this normal finding. In a nutshell, just think of VILCHAP. Okay, this is a mnemonics that we will use to summarize everything that we have discussed in your stage 1. So VILCHAP means the following terms here in my slides. So before that, we have here columns. First column, we have your fetal heart rate patterns, and adjacent to that, we have the interpretation. So we have the VILCHAP as the mnemonics. V stands for the variable deceleration. This is a fetal pattern. So if that happens, there is a cord compression, which is a very bad sign or very bad fetal heart rate pattern. Okay. We also have your letter E, stands for early deceleration. This signifies head compression, and we expect head compression, so that is okay. Next, we have your acceleration, that is 160 beats per minute of fetal heart rate. Okay, and that is okay, and we expect that one, and that is a normal sign. We also have your late deceleration, which signifies placental insufficiency, which is a bad sign. Okay, so in totality, our main responsibility or our main concern for stage 1 is to always check fetal heart rate. So the baby comes first. Okay, that is why we monitor the fetal activity, we monitor the fetal heart rate patterns. So that's for your stage 1. Now let's proceed to your stage 2. It is the birth of the baby. So it's time for the baby to come out and deliver the baby during the second stage of labor. So the most important topic or concept that we need to discuss in stage 2 is the order or process of childbirth. First, deliver the head, then suction the mouth, then the nose. It is very important to remove excess secretions from the mouth and nose in order to clear the airways in preparation for respiration. We also have to check a nuchal cord around the neck. So we have to check if there is an umbilical cord coiling around the neck of the baby. Then we deliver the shoulders and the body. Then after that, it is very important that we must have an IB band attached before the baby leaves the delivery area. that is for the purpose of identification. Now let's proceed to your stage 3. It is known as the delivery of placenta. After the baby is born, the mother likely feel a great sense of relief. The mother might hold the baby in their arms or on their abdomen. During the third stage of labor, mother will deliver the placenta. Okay? So basically, when we say stage 3, it's more of the delivery of the placenta. Okay? Our concern here is the placenta. If it is delivered completely outside the mother's womb or uterus. Okay. So make sure that it is intact. So our main responsibility here as a nurse is to really make sure that when the placenta has been delivered, we need to check if all the surface are complete. Okay? We really have to check each segment of that placenta if there is any missing cotyledons for that matter. Okay? That's very important to check. We also have to make sure that the cord has 3 vessels. So there should be 2 arteries and 1 vein. So as shown in this presentation, we have here a picture where there is 2 umbilical arteries and 1 umbilical vein. So for us to easily remember this is we have here a mnemonics, AVA. That means 2 arteries and 1 vein. Next, we proceed now to stage 4, or the recovery phase, or they call it postpartum. The hour or 2 after delivery, when the tone of the uterus is re-established as the uterus contracts again, expelling any remaining contents. Contractions are hastened by breastfeeding, which stimulates production of the hormone oxytocin. Okay. So the main concern here in your stage 4 is to maintain the firmness of your uterus. So it must be contracted so that retained fragments will be expelled from the uterus. So that's the main concern. And also we have here hormones such as your oxytocin. This is responsible for the contraction activity of your uterus. That is why we encourage breastfeeding after the delivery of the baby, because it aids on the because it has a contraction effects to the mother or to the uterus, so that any retained fragments will be expelled from the uterus. Again, we have here 4 things you do 4 times per hour in the 4th stage. Meaning there are 4 things or 4 tasks that you should do in your recovery phase or your stage 4, and it should be done 4 times per hour. Such as your vital signs monitoring. So you have to check for signs of shock. Okay? So your shock means there is a low blood volume in the body. Okay, so we're talking here about the mother, okay, after the delivery of the baby. So remember, during the delivery of the baby, it includes also blood loss, okay. So we have to monitor patients for shock. Maybe they had excessively or they have an excess blood loss during the procedure. So what are the signs of your shock? So you have to check if the pressures go down. That means the blood pressure goes down. Rates goes up, meaning the heart rate goes up. Okay, and the patient is pale, cold, and clammy. Okay, so your pressures go down means hypotension. Okay, that indicates low blood volume. Heart rates goes up. That means it's a compensatory mechanism of the body to compensate for the low blood volume or low blood pressure. So there is an inverse proportion or relationship between your blood pressure and your heart rate. We also have to check the fundus. Okay? If it's boggy, massage it. If it's displaced, you catheterize. Okay? In your displacement of the fundus, the main reason for this is full urinary bladder. So all you have to do is to catheterize the mother so that the urine will be drained and the fundus will be placed in the midline. We also have to check the pads. If bleeding excessively, she will saturate a pad 15 minutes or less. And lastly, roll her over to check for bleeding underneath her. Okay? So these are the 4 important tasks or things that you need to perform or do to your patient. And it should be done 4 times per hour. We also have your postpartum assessment. And we have here in mnemonics, bubble head. B, we have to assess for, again, letter B for breast. We need to assess the breast. We also have to assess the uterine fundus. It needs to be firm. If boggy, we need to massage. Needs to be midline. If not, we have to catheterize them. Height to fundus related to the belly button. And fundal height is equal to the days of postpartum. For example, 4th postpartum day, that means 4 centimeters below on the 4th day of postpartum. We also have to assess the bladder for distension, the bowel for obstruction or constipation, L for your lochia. Okay, these are your discharges after labor and delivery. So in the first days, we will observe a red discharge known as your rubra. And the following days, we'll have your pinkish discharge known as your serosa. And on the later days, we will observe a white discharge, which is called your lochia alba. Okay? And the amount should be 4 inches to 6 inches on a pad per hour. And that is a normal amount that the patient or that the mother should have. And saturate a pad 15 minutes or less is a bad sign. That means the patient is excessively bleeding. Okay? We also have your E, episiotomy. We have also to assess and observe the episiotomy site. Okay? Next, we have to monitor hemoglobin and hematocrit status. Since our patient loses some, for example, some blood, or there's a blood loss, so the hemoglobin and hematocrit indicators can be affected. Okay, so we have to monitor these laboratory findings or parameters. E stands for extremity check. So we have to look for thrombophlebitis and conduct a bilateral cuff circumference measurements. Okay? Since our patients or the mothers are usually bedridden, so they are prone to develop thrombophlebitis due to inactivity, okay, or due to bed rest. So we have to assess that one. It's a very important assessment. We need to take note. A for affect and B for discomfort. So we have to assess for pain that our patient is experiencing after labor and delivery. This ends our review presentation. Good job. You're done with stages of labor and delivery review discussion. More to go. Just keep reaching your goals. This has been Crazy Nurse RN YouTube channel. See you in our next review session. Please don't forget to subscribe, like, and share this video to your friends, classmates, and colleagues. Bye for now, students.